My name is Alexis Salazar, and I am the Mental Health Program Director with Alternative Family Services. I've been with AFS for the last 3 years, and it has been such rewarding work. And really, I've watched the work change so much, especially in the last year, with how we've all been impacted with this COVID pandemic. And it really brings to mind some of the difficulties that not only our staff have faced and us as adults have faced in this world, but really focusing on the impact of that vicarious trauma on our children and our youth. It has been devastating to see how much of our worlds have been shifted in such a way that really impacts the day-to-day living, the routines, all of the things that were familiar, comfortable, and safe for our youth who already struggled with an added layer of complexity with being part of the child welfare and mental health system of care. So really to just think about what our youth have experienced being in an environment where virtual therapy has been offered to them, but maybe they haven't been able to have a safe space with confidentiality, and even beyond confidentiality, just a safe space to be able to fall apart, if you will, and still be held by their clinician or by their caregivers in a way that maybe they have prior to the pandemic. We've got a lot of our clinicians who've tried their best to learn different techniques for how to support our youth, even with being so disconnected through virtual telehealth. And it's really been difficult because our youth all respond differently, and some of the traumas that our youth have been carrying, specifically the vicarious trauma of watching their adult parents, their adult caregivers, people around them also lose their jobs and really fall to all of the vulnerabilities that we've all seen and been exposed to in the last year especially. It's also been very difficult to have our youth really be part of the media and be part of the conversation, but be exposed in such a way that doesn't tell a true story or doesn't really expand on the narrative. And so our youth are sometimes caught in the middle of myths, in the middle of all of these different stories and narratives that are so unhealthy and unhelpful. And without being able to physically get out of that environment or physically get away and actually meet with their clinician in the community how they would, or coming into the office and being able to have a little snack and just break away from some of that busy routine has really impacted our youth in the form of not really knowing where is safe, where can I really let my guard down, right? And so we've seen this come up in different ways. We've seen children that have maybe met some of their goals, but then are regressing, if you will, and showing behaviors of earlier stages. And we really try and meet that with care because the vicarious trauma and the impact of it is real. And I keep naming it because that is what it is. We've all been watching each other suffer in different ways. And I also want to just add that layer of complexity for our clinicians who also are very skilled and gifted at trying to come in and support and are very passionate about their work, but have not been able to use their skills in the way that we've been trained. And so having to pivot, our youth have felt that, right? Our youth have felt some of the moments where maybe our strengths are not as prominent and where all of our mistakes or the things that maybe we've missed out on, some of the cues that we've missed because we weren't in front of the youth. And so really there's just, I think the biggest word that comes up for me right now is compassion. Having compassion for ourselves as we do this work, having compassion for the child that is trying to navigate their day-to-day that is no longer what they expected, what they planned for. And so really taking a breath, looking around you, and really trying to impart peace and kindness on the people around you because you know that they're struggling, especially our youth that need a little bit more patience sometimes because you might have thought that they've got it already and then they're showing behaviors where you're kind of wondering what happened. And that's where the clinician can come in and support in different ways. But that trauma is very real and we need to treat it as something that is to be learned about and curious about and hold space for rather than shun or shame or blame. So just thinking forward and thinking of all of the different ways that we are trying to navigate what we've got going on right now, it's so important to also hold some space for where we're trying to go. And unfortunately, I cannot say that we don't have any obstacles in the future. I'm actually very concerned for how our virtual therapy really is doing a service or not on our youth, and how other things that we do not have access to yet, so really technology being a big obstacle for our youth and in our lower economic communities, and really connecting them to something that is stable, that's reliable, is kind of the hard part, because we're in flux. We've got a lot of shifts coming. We don't really understand even ourselves, right? Like how our staffing is kind of flowing, and I'm speaking like in general, right? In this world of therapy, and being able to launch into virtual therapy services.